Hello everyone, my name is Antonia Anoloha. I'm a DMP student from Brandman University. I'm here to discuss integrated psychotherapy that I will use for my patient. My patient is a 55 years old African American male presented with major depressive disorder symptoms of decreased appetite, poor sleep, poor motivation, poor concentration, and increased anxiety because his director fired him from the job he worked for 25 years. He reported feeling guilty, worthless, helpless, angry, and overthinking how he will pay his bills. He reported drinking alcohol heavily because of his increased anxiety episode about paying his bills, and drinking helped him forget his past. The three psychotherapy modalities I'm going to use for this patient includes cognitive behavioral therapy, known as grounding techniques, gestalt therapy, motivational interviewing. Grounding technique is one of the cognitive behavioral therapy techniques used to help an individual to bring his or herself back in contact with the present moment. Grounding techniques use the power of the senses to bring attention to the present moment, which includes smell, sense of touch, sense of sound, sense of taste, and sense of sight. For this patient, I'm going to use sense of sight. For example, looking around to see pictures of things bring the patient's attention back to the present moment. The next therapy will be gestalt. Gestalt therapy is a person-centered approach that helps patients focus on the present and understand what is happening in their life right now, rather than what they may perceive to be happening based on their experience. The word gestalt means whole. Psychotherapist Fraser Pels developed gestalt therapy on the principle that humans are best viewed as a whole entity consisting of body, mind, soul, and best understand when viewed through their own eyes, not by looking back into the past, but by bringing the past into the present. The fundamental concepts of Gestalt therapy include figure and ground, awareness, present-centeredness, unfinished business, and personal responsibility. I'm going to talk about concepts of Gestalt. The first one is figure and ground. The figure is whatever we are paying attention to, while the ground is whatever is happening in the background. For example, as I am writing, I realize that I am thirsty. I get up, pour a glass of water, and then return to my writing. In response to my thirsty, I switch my frame of awareness from my writing to drinking water, and then back to my writing. The act of drinking water, satisfying my thirsty, completes the gestalt, and I am free to return to my writing. The next one is awareness, which allows the patient to restore his natural understanding of the present moment by focusing on the here and now. Personal responsibility gives patients the opportunity to own and accept their experiences, because in blaming others, they will lose their sense of control and become victim to the event. Unfinished business is things that are in our awareness but was incomplete, resulting in unexpressed emotions such as anger and depression. Most people tend to avoid these painful feelings instead of doing what is necessary to change. Now, the empty chair techniques is one of the Gestalt therapy exercise, which is a method of resolving unfinished business by bringing unexpressed emotion and unfulfilled needs into the present. So in the empty chair techniques, the therapist sets up 2 chairs for the patient, one of which is left empty. The patient sits in one chair and imagine the significant other with whom they have unfinished business in the empty chair. The patient is then instructed and helped to say what was left unsaid to the imaginary significant other. After that, the patient switches chairs and speaks to themselves as though they were the significant other. Through this dialogue, the patient's past emotions are brought into the present. The empty chair exercise can be beneficial in drawing out important perceptions, meanings, and other information that can help patients become more aware of emotional experience and how to start healing. The next therapy is motivational interviewing used for substance abuse, such as alcohol use. Motivational therapy focuses on improving an individual motivation to change. Those who engage in self-destructive behaviors may often be ambivalent or have little emotion to change such behaviors despite acknowledging the negative impact of said behaviors on health, family, life, or social functioning. Motivational therapy have 7 models that linked motivation with change. The first model is pre-contemplation, which is when patient is not ready to change. The second one, contemplation, when the patient is thinking about change. Preparation, getting ready to make the change, planning and commitment. Action is when the patient is making the change. Maintenance is when the patient is sustaining behavior change until integrated into a lifestyle. Relapse, when the patient is slipping back to previous behavior and re-entering the cycle to change. The last one is termination, when the patient is leaving the cycle of change. These 3 psychotherapy modalities are appropriate for my patient because of his anxiety, his depression, and his substance abuse, such as alcohol. The grounding technique is appropriate for the patient's anxiety by helping the patient feel anchored in the present, decreasing the intensity of his anxiety. Gestalt therapy teaches the patient to become aware of significant sensations within himself and his environment, to respond fully and reasonably to situations, allows the patient to manage his depression and anger towards his boss. Motivational interview helps the patient to identify his reasons for wanting to change, helping the patient to decrease or stop drinking. Now, here comes my patient. Hi.
Hello.
Do you understand and give consent for these sessions to be video and audio tape and be submitted to Brandman University?
Yes.
Good. I have not seen you in about a month. How is the previous intervention going?
I am not doing well. I am very anxious when I remember that I don't have a job, no money to pay my bills. This leads me to drink more alcohol. Also, when I remember that my boss fired me without asking me my own side of the story, I get depressed and angry.
Good. I heard you said you feel very anxious when you remember that you do not have a job.
Yes.
Now we are going to try something different called the grounding techniques.
Okay.
These techniques helps you refocusing your mind back from your situation to the present. Please look around the room and tell me what you can see in the room.
Okay. I see beautiful pictures, flowers, computers, and wall paintings.
Good. How do you feel?
These pictures help me to focus my mind on the present rather than thinking about lost job and bills to pay.
Good. When you are overwhelmed and anxious about your past situations, look at pictures of things in your rooms or around you. Doing that will help you bring your mind back to the present.
Yes.
We're going to do another therapy called Gestalt. I remember you mentioned that every time you remember your boss, you get depressed and angry.
Yes.
Okay. You will practice two chair exercise where you will talk to the empty chair as if your boss is sitting there. Those chairs, there is two chairs there. You sit on this one, then talk to the empty one as if your boss is sitting over there. Go ahead.
Okay. So, why did you fire me from a job that I've had worked for 25 years? Now I don't have insurance and benefits. All these were taken away from me because of you. Why do you do that to me without listening to my own side of story?
Good. I want you to switch chair, sit on the other one, and talk to yourself while you stayed, longer time in your job.
Okay. Why did you stay on this job for 25 years with this company without looking for another job? I was with this I was on this job because my previous boss was very good to me and other employees. The company have good insurance and benefits for their employees. All the employees were not afraid to lose their jobs, and the company has acquired other companies who were going out of business.
Good. How do you feel now
I feel
after talking to your boss and to yourself?
I feel much better and relieved after talking to my boss because my depression and anger went away from my shoulder. Also, talking to myself was good because I stopped blaming myself for being with the company for a very long time because my previous boss was good to me.
Good. The Gestalt therapy help you to become more self-aware and to accept and trust in your feelings and experiences to help you elevate your depression and anger. So we're going to do another therapy. It's called motivational interviewing. What can you tell me about your drinking?
Okay, I'm drinking too much, especially when I get anxious regarding the loss of my job and no money to pay my bills.
Okay, can you tell me how much you drink a day?
Yes, it's very embarrassing to talk, but I drink about 10 bottles of beer a day, especially when the anxious level increases. When I drink, I can't drive because I don't want to hurt people or myself, and I don't want to go to jail or get DUI on my license. When my anxious level is high, instead of buying alcohol, I rather go to the park, walk around, exercise, call my family and friends. I think stopping drinking will help me look for a job, calling my family and friends.
Good. This shows that you are concerned of your safety and safety of others by going to the park, exercise, and not drinking. And also by, not driving when you are drunk, which is very good. And not drinking will help you look for a job, as you said. So I appreciate your willingness and openness in your response, and I enjoy talking to you today.
Thank you, Doctor.
Good. I remember in the previous exercise you mentioned you were from Ghana. Is there a way your culture affects the way you react to circumstances and therapy?
Not really. My culture does not have any influence on my reaction to my circumstances and my therapy. My therapy will help me to get better and also get a job.
Good. Um, I'm going to see you next week to see how you are doing with this therapy. And also, please continue all this therapy you perform here, especially looking around if you are anxious, and also going to the park, exercising, calling your family and your friends if you are getting anxious and depressed instead of drinking. Okay? So, see you next week, and thank you for coming today.
Thank you for the session, Doctor. Thank you very much.
You're welcome, and goodbye.
Bye-bye.
This is the end of this patient section. In conclusion, I chose three psychotherapy modalities, which include grounding techniques, gestalt therapy, and motivational interview. The grounding technique helps the patient feel anchored in the present, which decreases the intensity of his anxiety. Gestalt therapy teaches the patient to become aware of significant sensation within himself and his environment, to respond fully and reasonable to situation, and also Gestalt help the patient to manage his depression and anger towards his boss. Motivational interviewing helps the patient identify his reason for wanting to change, which will help the patient decrease or stop his drinking problem. This is the end of the presentation. Thank you so much, and bye.